Hi guys, welcome to this interview. We've got to Dr. On, or I know her as Van. She's a GP since January 2020, I think, Van, you finished.
Yes.
And we're really lucky to have her on because we're here to talk about dyslexia, particularly in GP training, but for trainees across the board as well, and medical students and doctors. It's a topic that probably isn't talked about enough. And there are a lot of people who come to me with questions about dyslexia, and I don't know the ins and outs about it. So I thought I'd get someone who's been through it herself to give us a bit of insight into her journey through GP training, how dyslexia impacted her training, and how she came out the other end and is now supporting other trainees and other doctors going through the same. So welcome, Van. Thank you for taking the time out.
Thanks for having me.
No, it's a real pleasure. And I think we're going to learn a lot off you today. And I see you on social media and you're doing some amazing things around dyslexia awareness. So I thought you'd be the perfect person to come in and do this for. Now, when did we first meet? I'm trying to think back to when it was.
I think it was probably, it was either I did a webinar or I did I think I definitely met you for the, was it a Power CSA sort of course? I think that was probably it. It was one of those free master classes.
Yes.
And I was the first volunteer. I always push myself out there. And I was absolutely atrocious, but I didn't care. You lose your things when you get older.
This is in London. We did a CSA masterclass. Yes. And I remember no one usually volunteers. And I remember I asked, who's going to do the first case, thinking there's going to be big silence. And I was like, yeah, okay, I'll do it. And I was super surprised. And I remember that case actually. Gosh, that was a long time ago. So that was probably around 3 years ago now, would you say?
Yes.
3 years ago. Wow. Wow. And we've met a few times since then.
Yeah.
And then reconnected probably on social media since in the last couple of months.
Yes, and I've done your AKT mock. I did your CSA course. Yes, and loads of webinars.
Yeah, gosh, so you're fed up of me already, I'm sure. You're fed up of my voice, fed up of my teaching.
Everyone knows your voice in the household.
So tell me, this is all about dyslexia. So firstly, for people who don't know much about dyslexia, in a couple of lines, what is it and how does it impact people, particularly in training?
Yes, so dyslexia is where your mind, there's lots of evidence to back this up, where your wiring is different from your average person. So I wouldn't say it's abnormal as such, because I don't like to say it's abnormal, because it isn't. I don't think I'm abnormal. And your thinking is different. So from your experience with me, you can see I want details, I want specifics, I want the overview, and that's how I work. And every dyslexic will have their own. But generally speaking, their wiring, their pathways for processing knowledge is different. And mostly it affects the working memory. The average working memory for someone like yourself with no dyslexia is 5 seconds. So you can hold information, work with it, and use it. Whereas a dyslexic, for me, I've only got a 2-second working memory. So I compensate by working very quickly and very fastly, but it's very overwhelming and tiring. It mainly affects sort of reading and comprehension. So as you can see, for a medic, that can be quite challenging.
Yeah, absolutely. And we'll talk about how it impacted things like exams and preparation going forward, because obviously it must have had a huge impact. But what's your story, Anne? Give us a bit of a background. What's your setup? Now you're a GP, but a lot happened before then. So tell me, what's the background?
All was going quite swimmingly at secondary school. I came over as a refugee, so I had this language barrier, but I grasped that quite quickly. I'm originally from Vietnam. I was one of the Vietnamese refugees, so I had to learn the language. Went to ESOL classes. So I can't imagine that now, but ESOL classes, and then I did really well in primary school, and then went on to secondary school. And I worked really hard. I wasn't sure whether that was an Asian thing but I just felt it was just one of those things I did. I worked really hard, and I thought everyone did the same. But it wasn't normal. I didn't realize until years later that it wasn't normal. Well, not so much normal. It wasn't what people should have to put up with. So I aced all my exams, went to college, did science, biology, and maths, and my maths was fine. I even did it up to nearly university level, but I just found it really difficult. I was also working at the time, so I put it down to that, so I dropped out. So life got in the way, had a child, so I ended up sort of unemployed, single mom. My son was very young.
Mm.
And then bereavement happened. And then I rethought my life. I thought life is too short. And I always wanted to do forensic medicine, forensic pathology.
Okay.
And to be a pathologist, you had to train as a doctor and have surgical experience. So I researched that and I went back to college. Put my son in the nursery, so you're well supported when you're unemployed, so it's never give up.
Yeah.
And applied for all London universities. I didn't get support from the college. They said no one gets into the London University, etc. So I had to do it all on my own, all the statements and applications and all the research. That in itself was quite daunting. And then I got rejected, but I aced all my exams. So I went back to the universities I applied to, knocked on their door, and I think they sort of gave in and got fed up, and they said, okay, what were your marks? We'll interview you. And I was interviewed by an amazing professor. I didn't realize she was an amazing professor at the time. And the same day after the interview, I got in. I was delighted. So I got into King's.
Great.
And that was the beginning of my journey. And then sort of I was working as well throughout the first few years of medical school and raising my son. So it was quite challenging. Wow. So for someone who's dyslexic, who didn't know she was dyslexic, I was really organized. And what I found was having things to distract me and having that focus forced me to do really, really well and be organized. So you had no choice. And it was only into, I think it was the second year, we were quite lucky at King's. We had a student study support tutor. So I asked one of the girls, one of my fellow medics, I said, oh, how long did you take to read that chapter? She goes, about, I don't know, 40 minutes. I said, do you understand it? And I said, it took me 5 hours and I still don't understand it. So I got in touch with the study support tutor, and she did a screening questionnaire. And with the screening questionnaire, I can send you links for those sort of things. There was a possibility I was dyslexic. And then the student finance department funded it, because I know they're quite expensive. They range for anything from £400 to about £700-800. It's quite a lot of money. And it turned out I was dyslexic. So my report came out where I think some of the skills I was in the bottom 2%, and the basic skills, and other skills I was in the top 2%. So I've compensated for so well with the top skills. But I think it was more the fact that it was never picked up, because my maths was very good. My English was very good, because I'm quite particular. But I just ate books when I was younger, so it wasn't picked up. And that's how I discovered it.
Wow. So second year at med school.
Second year into medical school.
And then let's fast forward a little bit, and then you decided to obviously be going to GP training eventually several years down the line. Was it always GP, or was it because you said you had your forensic background in mind?
I did an elective in pathology, and I just didn't fancy 75% of my time looking down microscopes. I gave up on that. And I wanted to be an orthopedic surgeon, to be quite honest. And with anatomy and all the names, I have nominal dysphagia, and it wasn't ideal. And I love the manual stuff, assisting on Saturdays. But I was so burnt out, and I thought I couldn't do this anymore. I struggled as an F1, as an F2. I also have something called auditory processing deficit. You'll find that a lot of dyslexics sometimes they have other conditions as well, like dyspraxia and maybe ADHD. So I found that out sort of later on as well. So that complicated things. So the ward was terrible for me. I just could not hear, could not process. So I was so overwhelmed. So after I did finish F2, so I do advise people do finish F2, but I just felt inadequate. I felt stupid. I just thought, I'm not coping. So I wanted to leave. Luckily, I had very supportive friends. They said, why don't you do an F3? So I did an F3 worked for the spinal team, orthopedics again. So I was still thinking orthopedics. And then I did an F4 even. So I was helping a hospital roll out the e-noting as a prescribing doctor. And then I really wanted to leave medicine, but my friend said, why don't you be a GP? I thought, GP, I've been a worse GP. Not very tree hugging. I don't like children. I don't like moany people. But here I am. So I applied. Fortunately, I applied and I got in, and I thought very carefully about where I was going to go. So I asked my friend, and she said, "Why don't you apply for a place where that is known to be very supportive, more district hospital?"
Yeah.
And I think that was the best thing I ever did.
Wow. Wow. So what? Okay. So you started GP training. It was a 3-year scheme, like most people. August
Yes,
to August.
yes,
Okay. Full time.
full time. Yep,
Okay.
yep.
And when do you first think dyslexia impacted GP training? Was it from the beginning, or was it when exams came up?
Um, I think for me it was a beginning because it's psychiatry and there was so much reading, and I had she's an amazing psychiatrist, but I don't think she really wasn't used to having someone less academic and
Okay.
more sort of manual practical sort of thing. Not that I wasn't very good clinically, but it was processing all the reading material, because it's a lot of reading,
Yeah.
and I think it was a particular challenge because I've never met the patients.
Yeah.
Because we're quite multi-sensory, I found this on the ward as well, you're handing over patients you've never met. But if I've taken the history, I noticed this when I was on calls for surgery. When I had clocked them in, I've taken all their details. I remember all the numbers. I remember all the details without having writing anything down.
Wow.
And that was a bit of a light bulb moment for me. So, I could type notes 8 patients later, whereas before it's hand up. I had to write every single word. And that was really useful to know, I think.
Yeah. So you started to use it to your advantage and using the things that
I did and I didn't, just because it was still a new learning curve for me.
Yeah.
It worked for me, but then how do I translate it to my training? And it was just so busy, just never had the time to sit down and evaluate it, go to resources. So that's why I'm here now to point people in the right direction.
Really. So let's look at AKT. Let's look at CSA first, because a lot of people who I hear, trainees who I hear who contact me are having dyslexia, they tend to, they're struggling with AKT more than CSA. So tell me about
Absolutely.
your CSA journey first. How was that?
Yeah.
Was that a lot more straightforward for you?
It was. I mean, the first time I did the CSA, I still haven't passed the AKT because I think I failed it 3 times. I have no problems of saying I failed it loads of times because it's absolutely nothing wrong with it. I think it's important that you get that under your belt, you get that one experience. So that's really important. But I decided just to go for the CSA. I got a bit fed up with it. And it refocused my thinking. It was practicing. And because I was practicing, I became more interested in knowledge. So I went back and read up, and it made the AKT a bit easier to digest. So revising for that was a bit easier. But the first time I definitely wasn't ready. I knew that for a fact. And it was only, I was revising with a friend. You have to start early. I can't emphasize that, especially with dyslexics. And I just didn't get it. Even after, I think I even did your course before then, and you drummed in, red flags early on, and now it's my template. I mean, it should be everyone's template, to be quite honest. And then it suddenly clicked, and then I sort of failed it miserably. I had terrible interpersonal skills, apparently. So, so I was really shocked. I didn't think I did that badly.
I think I remember you told me afterwards, and I was surprised. I think I remember.
Yeah. But sometimes the nerves show through it. It just has a knock-on effect. So it was a very good experience. And in a way, so it was good that I did fail, because when I passed it, I knew I was ready to be a GP. Does that make sense? So it was an expensive learning curve.
Yeah, absolutely. Very expensive. But you did CSA second time then?
I did it the second time.
Okay.
And you say this a lot, saying you've got 24 hours to go, it's worth it. And that made such a difference, because I did the AKT, and a month later that it was a CSA. So I didn't have much time to organise revision with other people. And the penny dropped. And that's when I got the structure, the organisation, and it just all fell into place. I don't know what it was. I think I realised this is why I'm asking this. And it fell into place, and that was it.
Good. And with having dyslexia doing your CSA, are there any differences in the exams? I know with AKT you can have extra time, etc. But
yes, there are. So I mean, the first time I didn't. The second time it did. It's still the same amount of time in the consultation and the gaps between, like a normal clinic, which I completely agree with. But I think before the whole circuit, you get 10 minutes or 15 minutes to read the cases. To be quite honest, I wasn't sure whether it was an advantage or disadvantage, but it's nice to have that that available to us.
Yeah. So you get extra time before the exam to read through the cases if you wanted.
Yeah, yeah,
Okay.
not very long, but
Yeah.
still a little bit. So it
Okay.
helps you prepare, and I think it's good to have that on offer.
Okay. So CSA, you got through second time.
Yeah,
Dyslexia might have had some impact on it, but really it was AKT where I think you
it
felt
was
it most. So tell me about your
AKT.
AKT journey. Let's go through that then. When did you
Oh,
first take it
where do I start?
right to the end? Tell me.
Okay, so with the AKT, it was just the sheer volume and all the different specialties, and not knowing how much information, because each specialty is a specialty in itself,
Yeah.
and that was the problem. So, and then I was lugging around the Oxford Handbook of GP, and also the BNFs, and I downloaded apps. So I did questions all the time,
Yeah.
but I felt like it was just rote learning. It was only after I passed the CSA that things fell into place. So if you've passed the AKT a couple of times, I do recommend doing the CSA. It just resets you and refocus you, and think the knowledge just stays with you a
Yeah.
bit more.
A lot of people say
So
that. If
yeah,
they don't get through AKT a couple of times, they want to skip
yeah,
over and do
yeah,
something
and
else.
yeah, because I failed the AKT, I did have to have an extension. And normally, because you've passed the CSA, that's a disadvantage. You pass the CSA, but not the AKT, they put you back in the hospital. And with all the on calls, etc., it's going to be a nightmare.
Mm.
So I actually fought to stay in my GP practice.
Yeah.
So I was very fortunate to stay where I was, which was very supportive. I was settled there
Yeah.
for another 6 months, and I still failed. So
Yeah.
they relocated me. I still had to fight again for the second time
Yeah.
to stay in the GP practice, because that would be a disaster, especially with my sort of auditory process deficit. To
Yeah.
go back on the wards, you just won't have the time.
Yeah.
And they did offer sort of less than full time. But what I was going to do, I was going to sleep all day. I wasn't going to do anything. I wasn't getting the clinical experience which I really needed
Mm.
to trigger that interest and make it relevant, so that knowledge was a bit more natural
Yeah. Yeah.
and free flowing, which is what I needed.
Yeah.
So, yeah.
So you got through AKT on the fourth go.
No, the fifth go.
Fifth go.
Because I was dyslexic, I was allowed to have an additional attempt.
Okay. So did you have additional time in your AKT from the first go onwards, or was that
Yes, from the first go onwards, because I was diagnosed at medical school.
Yeah.
But if you weren't diagnosed, and with Aldini, if you failed twice, they usually send you to the professional support unit
Yeah.
to get assessed. This is a funny story. So after, I think it was the fourth attempt, they got me to have another assessment. And surprise, surprise, I'm still dyslexic.
Okay. Wow.
But because it was the last attempt, he did write in a report to consider giving me more than the time I needed.
Okay.
But it wasn't so much the time needed, because I usually finish more or less, even at medical school, more or less the same time, because my short working memory, I process information. But it was the fact that you felt you didn't have to rush it, and you had the time to focus and read it and rechecking. I think that made a difference.
Yeah. So the time thing, how much of an advantage is it to have, say, an extra quarter amount of time? Because that's what I often hear.
Yeah, it's usually that. It's an advantage because it reduces the stress. With anyone with dyslexia or dyspraxia, the stress component really throws their organisation out the window, and it makes for their cognition, their working memory. It's just an overload. It's too much. So to have that as a backup really makes a difference.
Okay. And I've heard that for some people, for a lot of people it does, but for some people, that particular advantage of having extra time doesn't really help them in their experience. So I guess it depends on everybody, doesn't it? How they...
It does. And one thing I would like to sort of maybe in the near future, so trying to support people with that, is getting an extension on, extra study days if they're dyslexic, to attend their dyslexia tutorial classes, and even a little extra funding, because they need slightly different books and extra things. So that's something that I've been thinking about, that I could sort of push for. And there's no reason, because dyslexia is covered by the Disability Act. And there's lots of other resources, help to work in stay in employment, that sort of thing, run by government. That's another thing. So I'm happy to talk to anyone who wants to talk about that as well.
Brilliant. And we'll put your contact details, if you're happy,
Yeah.
on the links
Yeah.
anyway, for people
Yes.
to get in touch with you.
Absolutely.
And how when you went to various rotations in GP training and you came up across various supervisors and things, how, when you mentioned that I've got dyslexia, how was that? What was the general reaction? Was there a variety in terms of how that was reacted to, or
No,
supportive?
I mean, so my first rotation, I think, I don't think I'm not sure if it was, but I don't think she really thought it existed. Others were quite supportive, but there wasn't anything put in place. You're more or less left on your own, because the rotation's set. You've got these on-calls, etc. You weren't really given any extra time or anything. I think that would have made a difference even if you were given 15 minutes to write your reflective account, before every shift started. Or something, I think that would have made a huge difference. And it's very little sacrifice to the workforce, really.
Yeah. Okay. And that's really useful for people, I think. And I think someone who has dyslexia, speaking to their supervisors, explaining their situation, explaining their needs, explaining that how their training could be altered to help, while still getting all the key things done that needs to be done in your rotation, and just making that little bit of flexibility might be useful. So maybe suggesting that they go and speak to their supervisors or
well, I'm hoping some of the supervisors will watch this as well.
Well,
So
hopefully. Okay, so let me talk about some of your, because obviously you failed a couple of exams. How many was it? You failed CSA once and AKT 4 times. How was that on mindset? Like, how did that, because that can hit people quite hard.
Yeah, it can. I think there was one time where I thought I should have passed. I was thinking, why didn't I pass? And I couldn't understand it because my marks didn't improve that much each attempt. But my knowledge was getting better. I felt more confident. I think there's, but most people walk out that AKT saying, "What the hell was that?" Don't they? I think after the first 2, I was quite devastated, and a bit down, depressed, and after that I got a bit immune to it.
Okay.
So, but it was I don't know, I was thinking, oh, I've got to do it all over again, because my knowledge is there. It's just remember the factual details and the emergency doses. Some are up to 6-8 years old, some 9 years, and that sort of thing really throws you. So I'm still learning. I'm still going getting your emails. I'm still looking at your videos because it's one of those things that I'm still learning because I discovered so late in life. And I was just going with the motion, going through the F1, F2. So there's no hurry. If you have to take an extension, I got 2 extensions. I feel I've become a better clinician as a result. And you're still getting paid. You'd have to look for your work. So I don't see it as a negative thing. It also meant that I was able to focus on promoting dyslexia and thinking back, this would be really useful for other people. And, so I've got loads of resources. I've started doing sort of list of resources, sort of running down problems, just little stories that people might be able to identify with, and saying, actually, that's okay as well.
Did you have anybody in your training that you knew you could talk to about this that had been through it maybe?
There was none when I was training, but a couple of people did fail a couple of times and they discovered they were dyslexic. So one had very mild dyslexia, one had dyslexia and dyspraxia he didn't know about. So that was pretty impressive. And they were all very good clinicians. They just kept failing the exams. So they got that extra time, etc. So
this is a really common story. There's people who fail AKT once or twice and they come to me and say, look, I've been offered screening for dyslexia. Should I do it? I don't think I've got dyslexia. Is it worth doing this screening? And what would you be advised to that?
I'd say just go for it because later in life you think, oh, I wish I'd done it, and they're paying for you. And if you are dyslexic, they will pay for a tutor. So this is what I'm saying. If you're dyslexic, I think they should have that extra time, study leave, to allow you to do these tutorials because it will help. They are experts on supporting dyslexic students, really, not just medics. And it does make a huge difference. I had a student, a GP trainee who contacted me. So I directed her to a certain tutor and she passed after help, whether she would have passed anyway. But, if the support's there, why not?
Yeah, and this is what I always say. Look,
Yeah,
if the offer's there to do a screen, take it, because
yeah,
if you say no, A, it's going to look like you're not taking advice
yeah,
and support that's
yeah,
been
yeah,
offered, and B, you just never know. These
yeah.
some people who are diagnosed with dyslexia after failing ACT twice would never ever have thought this is a possibility.
Yeah. Well,
So
that's just it. Because their compensatory mechanisms are so strong,
yeah.
you wouldn't think, because so many people are, you're not dyslexic, that my eye. It's like, so it's quite discouraging, but it's also flattering in another sense as well.
Yeah, because you're still maintaining and still pushing people
Exactly.
to
Yeah.
get them.
People wouldn't have a clue that you're struggling.
So let's talk strategies then. So you obviously,
Mm.
once you got through AKT in the end, you would have
Mm.
changed, I guess, in the way that you were preparing from AKT1
Yeah.
up to
Yeah.
AKT5. So
Yeah.
what kind of strategies did you learn along the way that worked for you?
So I always had lists. I had lists the size, yeah, the length of your arm. In
Okay.
the end, I just did it straight away, because you've got the memory curve, and the more contact you have with the same information, the more likely it is to go into long-term memory. So with the long-term memory, so that's what we have problems with, putting things from the working memory into long-term memory, because it
Okay.
will just disappear. So I found turning into pictures really help, because I visualize. So but it's still a learning curve for me. I'm still quite new. I've not got strategies that work for me, but I'm having fun doing it, which is great. Whereas before it used to be chores, like I have to know this information, I have to know. But now, think, okay, I'll try this one. I'll try this one. I've even tried to sort of, because I knit and I sew, and I try to incorporate it into the number of stitches for, that
Yeah.
sort of thing. You've got to try and be creative, and then you come out with a lovely artistic piece, so to show for it. And then I think then I got really heavy, didn't I, with the webinars and
Yeah.
the
Yeah.
audio from
Yeah.
in the car.
Yeah.
So it was everything really. But I enjoyed it. I think that was a difference, knowing, oh, actually, this is the way I'm learning, and the tutorials helped. So have you tried this? Have you tried that? So I think that made a difference, but I'm still learning.
And you mentioned the audiobooks that we do. How
Mm.
did audio help? Did that help to keep memory in a different way, or did you find it beneficial?
I think it was a combination of everything. It helped to reinforce it, because you're learning the information again. When you're processing the information again, and every time you process it, no matter how many times, it's like the CSA, something clicks. You think,
Mm,
ah,
mm.
So and unless you know yourself really well, which I don't with my
Yes.
dyslexia, that won't click. And then every time something clicks, you think back, why did it click? You think, oh, because I've missed this. Because you don't think, because we think dyslexics think everything's important, whereas we don't know how to filter, because we haven't got that time to process it. So
Mm.
then it becomes overwhelming, and we don't know where to stop. So I think that's why when we had this, you asked for the interview, I wanted to know details. I wanted the overview,
Yeah.
and it's difficult. So I had to stop myself a bit. so
Yeah.
um, so
That's
I
really
like to have
interesting.
an overview. So I learned to, right, okay, scan the titles, look
Yeah.
at the summary at the end, and then go back. You don't have to read a book or read for knowledge in a conventional way. A lot of people have that strategy, but they don't realize they're doing it.
Yeah.
And then just have one page, instead of writing reams of notes, which I was doing,
Mm.
is to have one page, write 1 or 2 words, force yourself to do that. Because you're not going to read your own notes again, especially if they're messy, which I never did. So I just saved notes, and in the end, I just threw them all in the bin
Yeah.
and started from scratch.
Okay.
And have loads of questions every day.
Yeah.
20 questions is not enough. Do hundreds.
Yeah.
What I should have done was plan 1 year in advance. This is a timeline. This is the topics,
Yeah.
and tie it in with your rotations. That's the best time to ask questions. And plan your tutorials. Okay, I've seen a patient this week. I want to talk about this and this. Plan them. Take control of your training is what I'm saying.
Mm. And that's a really, really important point, because only you know what's going to benefit you best. And
Yeah,
therefore you need to let maybe other people know, this is how I need to plan my way to get the most out of
yeah.
this rotation. And maybe that's an important point to take forward, that,
Mm,
some people don't understand your needs, and therefore you need to
mm,
maybe explain to them and hopefully get a comeback which is supportive
mm,
and helpful. That may
mm.
not always be the case, but hopefully you can only try.
Sure.
Um, so you've tried lots of different things, which is great, and you
Yeah,
somehow found a combination of things that work for you.
exactly. Yeah.
And
I
like
don't know if it worked for me, but it got me through the exams,
well,
is what I'm saying. Yeah,
exams. Yeah, yeah.
yeah.
And I guess, and one thing that people often say is when they have failed exams 3, 4 times and then get through, it
Yeah,
has that in the long run, when they look back, of course, at the
yeah,
time, it's very difficult and your confidence is hit. But looking back, they always say, well, actually, it really helped that I had to go through it a few times.
exactly, exactly. So one thing I can say about with regards, before I forget, being moved around is extremely disruptive. So I was very lucky. But when I had my second extension, my first extension, there was another GP trainee, so I was kicked out of the room, and it was so I was hot desking, and that's not ideal because I had my printer, my color printed set up, the printer set up in the room. I knew where everything was. I mean, I'm quite adaptable, so I think it was okay. It's not ideal though. So moving around and moving to another, you'll have to learn everything. It takes you a good month to know all the different systems again.
Yeah.
So if you can, try and fight to stay in the same place, especially if you've been doing well clinically, you've got that support and backup.
And explaining that, because a lot of people say, well, I'd prefer to stay where I am, but explaining the reasons behind
Exactly,
it, very
exactly.
important. Yeah. Because
Exactly.
I guess a lot of people will say they want to do that, and they probably hear that a lot. But really explaining, this is not just me wanting to stay here. This is why it
There's a
needs to
reason,
happen.
yeah, because you don't have to relearn the personalities, etc. There is a rationale, I think, with the deaneries. They think if you're not doing well here, it's because it could be the supervision, but that's not necessarily true, because we're quite self-starters. We know we want to do well. It's not so much that. But in the end, I did go to another one because that was one of the stipulations of the extension, and I struggled. I really did struggle, so it wasn't ideal.
So it's communication, isn't it? It's explaining
It is.
so that people understand, why things have got to this point, and how am I going to move forward in the way that suits me best. So since then, you've obviously been a GP now since January, and you started to do a lot of work on social media about helping other trainees with dyslexia. So tell me some of the stuff that you're doing on social media, and why have you chosen social media to
well, I thought I wanted to jump on a bandwagon. I'm always on my phone. I thought I may as well make use of it. And I found that there wasn't much approachability. It's all very academic. It's got to go through the channels, and who do you ask? So I'm putting it out there to raise awareness of what's available, be an approachable face. A few people have contacted me and support them, and I enjoy doing that, because there's things I wish I knew beforehand. I didn't realize there was access to work funding. Okay, so I'll send you links on that. And also it's covered by the Disability Act, so you can push for extra time to do your portfolio, or maybe allocated a specific area where you can have quiet and not be disturbed. Someone can hold your bleep or something for that 10 minutes or 15 minutes to do a reflective account. All of that, because struggling with the training, the exams, and maintaining a portfolio is very overwhelming.
Yeah. And I think it's amazing what you do. I've seen some of the stuff that you do and the posts that you put out, and a lot of it's encouragement.
Thank you.
A lot of it's confidence, encourage,ment, and like you said, just making it more aware and people more okay to talk about it, which I think is really helpful, because a lot of people deal with it and they come to me and say, look, I've got dyslexia, but I don't feel I'm getting the support I need. And now we can start to point people in directions like to people like to yourself. So if you had to think of 3 resources off the top of your head that are really, really important for GP trainers to know about if they have been told they've got dyslexia, or if they know they have already, which 3 would you put high up there?
Professional support unit, because they will fund you a professional tutor. What I found, Tony Buzan's books, because they're very easy to read, they're quick, especially if you've got exams coming up, to learn strategies to help memorize facts, which I find very difficult. Resources would be sort of your resources with the multi-sensory input, with the webinars. I find the webinars the most important. I think the interaction and the notes you gave were really good, because they were very pictorial, and there was a bit of humor which made a difference, and it wasn't loaded with information. It was the key points which we had trouble with, as dyslexics have trouble filtering out to those points.
So let's just try and tick off all the things that you did use from us, actually. Let's just try and go from the beginning. So I know you came to our Big Mock course and the Immersion CSA course. You did our AKT webinars.
Yep.
That was before we don't have AKT webinars, like we have AKT online courses. So they're the same, but you can do them in your own time.
Yeah.
Audiobooks you obviously use, was it AKT and CSA or just one of them?
It was a CSA one I did.
CSA one. And that's, I think when you were training, that was all that we were doing really. So
Yeah.
now we have flashcards.
Now I've bought the flashcards.
You bought that as a GP, didn't you?
Yeah, I did, and it's amazing. So I'm going to use those to try and think of strategies where, you know, to memorize stuff, and so for my own learning curve. But eventually, you know, I want to be able to read something and just know stuff, and that's completely possible.
Yeah, and your learning is still just at the beginning, isn't it, as a GP? And it's all.
It is, and I love it. And what I was telling you about not going to different locations, what do? I'm a locum. I go to different locations struggling. so I just hold, so get the ball by its horns, just embrace it is what I say.
Yes. Well, for anyone who's watching who wants to see some of your stuff, what are the main handles you're on social media? Tell us the link.
It's all very new. So I've got a Facebook page. They're both called The Dyslexic Medic. It's very light-hearted. It's a bit of fun. So I post links and anything new that I think would be quite useful. So I like to research it and make sure it's really sort of reputable and things like that. So it's not a lot. It's nothing that you need to say, oh, well, I'm not sure this is it. It's from my own experience, or there's a lot of evidence behind it. And I'm free to be messaged directly as well, which some people have done.
That's really useful for people. So on Facebook, you're the Dyslexic Medic Facebook page, and then you're on Instagram as well, the Dyslexic Medic.
Yes. I'm thinking about Twitter soon and LinkedIn.
Yeah, do it, because I think the more aware, and the thing about social media is not everybody's on every channel. So
yes, exactly.
We are on YouTube, Instagram, Twitter, LinkedIn, everywhere is because people choose their own channels, and if you're going to get to everybody, then you go to all of them. So it's really good that you look at Twitter and LinkedIn as well. I look forward to seeing you on that. Now, whenever we do our talks, we always like to help people out. So anyone who's watching this right now, if you want to get 10% discount on anything that Van has said that she used, that she found helpful, just contact me and say, I watched Van's interview and and we will give you a 10% code to use on any one of our products. But Van, thank you so much. I know you're on a tight schedule today. You've got some interesting things coming up, I think, today.
Yep.
What's going on? Anything you can tell everybody?
NHS haircut. My friend's birthday today.
Very good.
It's a precious day off because I'm on duty. I was working Friday, Saturday, so it's a precious day off, and I'm working Monday. So.
Okay, you are non-stop. I see your images of your.
I love it though. I love being a GP. So for those who don't get there straight away, honestly, it's worth the work because you will just have so much freedom to do what you want. So I've had time to do this, my makeup channel as well as my dyslexic channel, and just work less hours and really enjoy the work.
And it's such a positive thing to end on, because you've been through struggles, you've been through those difficult times, you've been through exam failure, you've been through queries, should I continue or not, you've been through extensions, and still you're at the end smiling and you're planning your own future and you're enjoying your job, which is the ultimate thing, I think. So if that gives people confidence, if that gives people a bit of motivation when they're going through difficult times with dyslexia at the moment, and particularly around AKT, this has been hopefully some value to them. So thank you so much for your time.
You're welcome. Thanks for asking me to talk.
Thanks,
Take care.
Bye.